Hi guys, I am Chan, and this is my truth versus myth video. Uh, Fun fact about me is I can say my ABCs. Yeah. So I was in a pretty large acute care setting in Toledo. There was a lot of stuff I learned and a lot of stuff that will always be in my heart. So, very nice experience. Glad I got the acute care setting over with, but a lot of people have their own personal preferences, and honestly, it was a great 6 weeks. I learned a lot. So the clinic itself was very big. There was a lot of therapists there, to a point where I didn't know any of their names. There was like I knew probably like two people's names there, and because there's too many people there. Any cool equipment? Maybe a skylift. Yeah. Anything besides that? No. There's no pool or any cool adaptive equipments like that. Just your typical old hospital equipment. The patient caseload I was experiencing was about 10 to 12 patients a day. I was probably spend 23 to 38 minutes with them per patient, depending on how acute their case was. But yeah, it just varies. You just want to stay around the 2 billion units to 3 billion units area. Yeah, so I saw a lot of where I was mostly for about 4 weeks, and I ventured off after those 4 weeks. I was post open heart patient, so after you get your open heart surgery, typical standard procedures to move around, go for a walk, do some exercises with them, and just work on transfers, bed mobility, and stuff like that. So very good experience with that. Post op, yeah, a lot of post op. So I was on the neuro floor for some time. I was on the orthopedic floor for some times. They were experiencing a lot of chronic pain or an acute pain due to the surgery they were experiencing. So yeah, my day to day was like, oh, okay, my day to day. So I get there 7 a.m. Boom, from 7 to 8, I would write down all the patients I was seeing, from like 10 to 20 patients. Yeah, I have about 20 patients on my caseload, but I only got to see 10 to 12 per day. And you get to pick who you want to see depending on when they were seen last and how acute they are. So write all the patients down, their past medical history, their diagnosis, what kind of cyst they are, so if they're mod, max, min, standby, transfer, stuff like that. Um, you write down stuff like that. Gait, how far they walked, what kind of assistance they needed, if they had any assistive device, and stuff like that. Bed mobility, how did they get out of bed? So they get out of the left side of the bed, right side of the bed, they log roll, they use handrails, was the bed elevated? So all these little things you gotta take into account when you're in acute care, because the therapists are just, they're saying next, they don't know any of these things. So making sure you're documenting is very important for that. So did I get lunch? Of course I got lunch. I'm a hungry boy. Lunch lasted for about an hour. I just ate by myself. The therapist team asked me if I wanted to go eat lunch with them, but I personally like my own private time, especially after working 8 to 9 hours a day. Um, just have my own personal time. So what I did on my lunch break, I ate lunch and I just sat on my phone. Yeah, pretty chill. Um, how it was different from the end, from the beginning. The end, I was very comfortable with the situation where I was put, but when I was in the beginning, I was pretty uncomfortable. Very timid, and I was scared to ask questions, and I was scared to look stupid. I was scared to be wrong, and that's how me and my CI came to that conclusion. I'm scared to be wrong, so also, yeah, don't be scared to be wrong. Um, yeah. Three myths about my large um, clinical experience was that all my patients were going to be very acute, um, which some of them were. A lot had a lot of max assists, a lot of people that couldn't get out of bed, stuff like that. But I had some patients that were able to walk on their own, use the bathroom on their own, and just walk around on their own. So yeah. And another myth is the nurses aren't friendly, which I don't know why people said that, but you can even ask the nurses questions, and since they're really good at their job over there, asking them questions. They're very friendly. So yeah. And the last myth before I went into my clinical was you have to know everything about the acute care setting. Well, I didn't know anything when I went into the acute care setting. Don't be scared. When you get there, you learn on the job. Um, she taught me a lot of things, which I really appreciate. So about this large acute care setting, all you have to what you have to know before is gait patterns, transfers, how to get them out of bed, your assist levels, the gait patterns I already said, assist device, stuff like that. And just like personal hygiene too, you gotta clean up a lot of patients. So three truths about this clinic: you have to wipe patients' butt, you have to clean them up. They will have tendencies to urine over themselves, so you gotta clean the bed because they're physically unable to take care of themselves. So you yourself have to take care of them. So cleaning them up, you can get a nurse to help you, but yeah, if you walk into a room and the patients wet themselves or you can smell stool, it's personally your responsibility to help clean it up. So yeah. Another truth about this clinical is you'll you'll learn a lot. Honestly, I learned a lot. It's a great experience, and yeah, learned about all these protocols, all these procedures. Great experience. And the final truth is, if you get to see a surgery, go see a surgery. I got to watch an open heart surgery. It was a great time. Lasted about 6 hours. And yeah, do it if it's offered to you. One thing I did prepare was just look over the acute care book. So like definitely look over bed mobility, how to get them out of bed. I know it sounds very simple, but it's not as simple as it sounds. But in transfers and gait patterns, which is my recommendations to you guys. Um, the biggest takeaway from the experience and that's helpful for you guys is what I just said, like gait patterns, transfers, and bed mobility. Those three things are your biggest things you'll probably do at the acute care setting. Yeah, thank you.